Hi everyone, my name is Salma Ibrahim and my summer research project is on the associations between poverty and attentional processes in middle childhood. Prior research emphasizes the implication that early exposure to poverty and related adversities has on children's health, development, and learning. Attentional processes might be a mechanism underlying associations between poverty and health. However, it remains unclear the processes in which poverty-related experiences have general or specific effects on attention under various conditions. And the emergence of such specificity could suggest the development of adaptive strategies. The present study examined the unique effects of environmental exposures on domain-specific attention processes in middle childhood. We hypothesize that family income and material deprivation will be associated with attention more generally, and we also anticipate that attention will be differentially influenced by each of these exposures. First, greater sociocognitive resources will be more positively associated with hypervigilance to threat than attention in benign conditions. Than attention in threatening conditions. In contrast, psychosocial threat will be more positively associated with hypervigilance to threat than attention in benign conditions. We used data from the Family Life Project, a prospective longitudinal study with a sample size of 1,292 children in predominantly low-income and rural communities of North Carolina and Pennsylvania, and 2/3 of which are under twice the poverty level. Families were seen in 2 to 3 hour home visits when the children were between the ages of 6 months and 12 years of age. During the visits, the primary caregivers, in 99% of the cases the mother, completed questionnaires concerning family demographics, income, economic hardship, family conflict, and child behavior. We ran a series of multiple regression models controlling for demographic covariates, age, race, site, and gender, and early executive function. Then we added predictor variables, INR, income to need ratio, material deprivation, sociocognitive resources, and psychosocial threat. We ran these variables under two outcomes. The first, executive attention in the benign condition, measured using the hearts and flowers accuracy on mixed blocks at child age 12, and attention bias, attention in the threatening condition, measured using the dot probe attention bias to threat at child age 12. In each outcome, we observed the main effects looking at the specific and additive effects of each variable on attention and how these associations differ between individuals at each outcome at child age 12, so we can examine the variance in kids in these associations. On the left, you can see my significant findings. So in model 1, we began by just adding the covariates. And the typical ones that you would expect, like age and early executive function, came out as significant. After controlling for those variables, we added in our more proximal level exposures. Firstly, income to need ratio, which originally came out as significant, which means greater income to need ratio is associated with greater executive attention. But as soon as we added these more proximal level exposures, specifically sociocognitive resources, which is characterized by greater social contact with parents and access to material and learning outlets in the home. So when we added those more proximal levels, sociocognitive resources, greater sociocognitive resources was associated with greater executive attention, and incomes to need ratio dropped in statistical significance. And you can see the relationship of these effects in the graph above. From these results, we can infer that in the context of poverty, greater sociocognitive resources in the home promote attentional processes and conditions in middle childhood. In conclusion, these findings demonstrate the additive and specific ways distal and proximal level exposures associated with poverty influence youth attentional processes, and future analyses will examine the interactive effects. Leveraging and enhancing the strengths and resources of families experiencing poverty is a useful target for interventions and policies. I appreciate the direction from my mentors in the Basel Lab, our PI, Dr. Berry, and especially my graduate student mentors, Mariah DeJoseph and Kira Lenneman. And thank you to the MSROP coordinators, Heidi and Vicky, and my fellow peers in the cohort. Even though this summer was super unconventional, I feel like I was able to enjoy it a lot thanks to you guys. And thank you to everyone else who attended. And if you have any questions, please let me know.
Great presentation. I'm really proud of you all. I do have a question. So you noted that some of the data was from rural areas and in urban areas as well, or just rural?
Strictly rural areas for the Family Life Project.
Yeah, and I know you didn't gather that data by any means, so you might not know the answer for this. But do you think that there would be a difference between more rural-based poverty or urban-based poverty? And if so, could you discuss what you think that would be?
Yeah, I think the point of them like getting data from the rural-based communities, I think it's like rooted in the fact that perhaps children in from urban backgrounds have more resources in school and like are exposed to different things compared to children in rural communities, which it's a very small community, and perhaps schooling is different and what they're exposed to compared to children living in more urban metro areas is what I assume. So their experience of poverty would be a lot more different than children living in more urban areas that might have more resources like welfare and stuff like that compared.
Thank you so much. That's a great answer. I study rurality, so I'm always really interested in the differences of that. So thank you very much.
Hi, Salma. That's a really nice study, a tremendous data analysis. I'm wondering if there are any interventions that can be done to bring more resources into homes. Is it, broadband internet access? Are there simple things that can be done?
So in my discussions with my mentor, we talk about a lot of the fact that when targeting poverty in families, we tend to focus more on material deprivation and like income and stuff like that. And as you can see, like even from the results of my study, it seems that rather than like focusing on more like money and things like that, perhaps giving more resources in the home, like books to parents and like programs where parents can learn how to like encourage their children to like learn more, that might have a way better effect than like kind of like giving them more welfare and stuff like that. So focusing on the ways that family can like maximize their efforts towards their children rather than providing them with monetary benefits strictly isn't helping like the like cognitive development of children from these like low income backgrounds who are already struggling with a lot of adversities from like their environment. Perhaps you need to like maximize how they're interacting with their parents to like increase their mental abilities and learning behaviors.
Thank you.
Any other questions?
Yeah, I was going to ask too. Well, thank you very much, Salma. That was really great.
Thank you.
So our next presenter is OTV Mayo, and Heidi will share the screen, but we'll wait a few minutes because I don't want to get too ahead of our scheduled time so that people coming to see presentations don't miss anything. So we'll put you on the spot, OTV, until you're until you start presenting.
Sorry, Selma, I just had a question about your table. You had two variables that were acronyms. I think it was like NC and EF. I was just wondering what those stood for.
NC is North Carolina because like we had North Carolina versus Pennsylvania, and then at EF is early executive function.
Okay, thanks.
No problem.
I actually have another question that just came to me. As someone who doesn't know this at all in the field, but like, what would be an example of like early executive functioning? Oh, sorry, you're muted.
Early executive function, I guess, is like our way of measuring cognitive abilities in children. So I guess I can't think of a specific example, but I can just say that it's like how we measure their cognitive development and etc.
Cool, thank you very much.
I've got a question too. See, the longer we sit here, the more questions we come up with. So are you going to continue with this research, Salma?
We were thinking of expanding it for to present at SRCD in the spring, but we're thinking maybe just keeping what we have so far as an option too, but we're looking into it.
Okay, thanks.